Hello, Brenda. This is my PNF video. This is my patient, my dad. We're going to call him Patient J, Mr. J. What we're going to be doing today for you to know is we're going to be doing PNF D1 and D2 flexion and extension. We're going to be doing it bilaterally. We won't do it bilaterally, but Renee says if you say you're doing it, then you don't have to do it. As well as we're going to be doing passive range of motion to assess his range of motion using a lumbrical grip, maintaining constant contact with the patient at all times, and correct body mechanics. We're going to push him as far as he can go if he has any impairments or hypersensitivities of any kind, and see if we can get some movement patterns to increase his range of motion, as well as neuromuscular facilitation. So I'm gonna start by introducing myself with the wipers to my patient. Hello, my hands are clean, just washed them up, viruses and everything about. What is your name, sir?
Mr. J.
Mr. J, nice to meet you.
Good to meet
Check second identification, good to meet you. So here's what we're gonna do today, Mr. J. I hear you've had, or been having, a hard time picking up trash with your foot.
Yes.
And throwing it in the trash can like you usually do.
Yes.
Is that true? Let me ask you a couple questions. Does it hurt in any way when you do this?
Yes. It hurts. It hurts, and
Okay.
it's I don't have as much mobility when I'm picking them up.
Mm-hmm. And maybe a little lack of control too.
Right.
Okay. So we're in a safe environment. Everything's closed in the exam room for your privacy. What we're going to do is we're going to lay you down and we're going to go through some motions, which is called PNF, which is neuromuscular facilitation. Peripheral neuromuscular facilitation. So I'm going to have you lie down after we take a look at the skin and everything, and we're going to go through those motions and see if we can't get a pattern going that increases your ability to maintain your foot in the correct plane of motion when you pick up trash, increase stability, range of motion, and everything like that. Does that make sense? Do I have permission to do that?
Yes, please.
Excellent, excellent. So what we're going to have you do is, we're going to have you lay down for me. Good, good. Actually, just stay seated for 1 sec. I'm going to show you, good, good. Show you kind of what these are, all right? The first one is called flexion extension. We'll just call it D1 for short, right?
Okay.
D1 is what you do is think of it as feeding yourself with your foot or throwing away the trash.
Mm-hmm.
So if you're in a standing position or laying, imagine I was laying down, you're going to bring your foot up as high as you can to your head so you can grab your trash, right?
Mm-hmm.
And then on the opposite end, you're going to push it down and point your toe out to the other way.
Okay.
Okay? So that's D1. The coming up is called flexion, and the going out is called extension.
Okay.
Okay, so that's what we're going to try first. So now, let's have you lay down for me. Good, good, nice and careful. Scoot this way for me. Good. And good, excellent, very good. Are you comfortable?
Mm-hmm.
Good. So,
Which foot do you like to do first?
I think we'll start with okay, so let's get started. I'm going to help you move it.
Mm-hmm.
So I'm going to grab, using the lumbrical grip, so just the outside of my fingers, not a hard grip.
Mm-hmm.
Grab over here on the outer lateral epicondyle of the knee,
Mm-hmm.
and then on the bottom of the foot. So now what you're going to do is you're going to bring the knee up, good, and then pull in, just like that, good. So what you're doing is you're flexing the hip, come back down to regular, flexing the knee,
Mm-hmm.
and you're externally rotating your hip,
Mm-hmm.
as well as dorsal flexing the foot and inverting it, right?
Mm-hmm.
I know that's a lot of words, but just bear with me.
Okay.
Okay, so let's do that again. Ready?
Okay.
Flex the knee, bring it up, bring the foot to the other arm. Good, good, good. Twist that foot up. Good, and down. Now the opposite is you're going to push the foot back out towards me here, like this, right?
Mm-hmm.
Push the knee back into extension, so straighten it, and then straighten that hip, and then push that foot out and push it down.
Mm-hmm.
So now let's do the extension. So extend and point that toe away. Plantar flex that foot, push down. Right there, all the way. Good. No pain?
Yeah, a little bit.
A little bit of pain right there. Okay, so now we're gonna come back to midline.
Okay.
We're gonna do that whole motion again. We're gonna bring the knee up.
Okay.
Bring the leg up and bring the foot up.
Okay.
And then we're gonna push it down and out. Okay? Ready? Let's go. We go up, knee flexed, foot inverted, push up, and then back the other way. Internally rotating the hip, extending the knee, extending the hip, and plantar flexing the foot. Good. All the way up. Flex the knee, foot up. Good. As high as you can. Good. And then down. Nice and controlled. And point. Very good. Now I'm going to let you rest. You're going to give it a shot on your own, okay?
Okay.
Okay?
You ready?
Let's go. Let's see how you do. Up, up, up. Good. External rotation, inversion. Good. Push out. Straighten that leg and then push away. Push away. Good. One more time.
Doesn't hurt as bad now.
Yeah, good. One more time. All the way up. And down. Pushing out. Very good. Now come nice and straight for me. Good. Good, good. So what you're doing is you're coming into hip flexion, abduction of the leg. Well, actually, when you're going in, it's adduction. When you're going away, it's abduction.
Right.
So it's adduction of the leg, external rotation of the hip because the hip joint goes away.
Right.
Flexion of the knee. Inversion of the foot because it tilts up and in. And extension of the toes. I forgot to say that, but that's the very end. So remember, you finish with the toe.
Okay.
Okay, and then when you go out, extending the knee, the hip, internally rotating the hip, as well as plantar flexing when that hurt a little bit, pushing through that. If the pain is too bad, stop. But if you can push through it nice and gently, go ahead and do that. And then everting the foot, pushing out, and flexing the toes.
Can I do it and make sure I remember how to do it?
Let's do it one more time. I'm going to do it with you, and then you can do it on your own. Ready?
Okay, ready.
All right. And up to your head.
Curl the toes.
Good. And down. Point away. Point. Brilliant. Ready? Go for it. All you. Good plantar flex. At the bottom. Now flex that foot. Good. All right. And rest.
Very good.
Very good. Okay. So I want you to do that 10 times a day for 3 sets.
Okay.
Each limb till you really get that muscle memory down and kind of work through those little kinks and pains to try to make this a little bit easier for you.
Yeah, this leg feels a lot more limber now than this one.
Yeah.
I feel like I should do it with this one too.
Let's do it. Good grip. Okay, so you remember how to do it, right?
Yeah.
I'm just gonna guide your foot, and then I'm gonna add a little bit of resistance at the bottom. You ready? At the top. Ready?
Okay.
Go for it. Good. And then down and out. Good. Okay, I'm gonna add resistance.
Which way? Up again?
I'm gonna add resistance to the way that you're moving.
Okay.
Okay, now up. Little bit of resistance. Push. Good. And then switch the grip. And push. Good. One more time.
Okay.
Up. And then down. One more time.
Neutral.
Flex everything, the toes. Good. And then pressure here. And straight. Very good. That's how you're going to do it. Okay. So now, let's have you sit up for me, and we're going to do our last pattern. Okay, Mr. J, last part. Always the hardest.
Okay.
You got to push through this, okay?
Okay.
So this is D2 flexion extension. So what you do is you flex the hip, comes up, abduct the leg, internally rotate the hip so the leg comes away, flex the knee, of course, and evert the foot. So you're bringing the trash back this way, right? And then extending it, you're going to extend the hip, extend the knee, adduct the leg, plantar flex the foot, inversion, so it's coming up, and toes in flexion. Okay?
Okay.
Watch me do it one more time. Flexion, external rotation, eversion, dorsiflexion, abduction, toes extended. That's hard. Extension, adduction, external rotation, extension of the knee, plantar flexion, pushing away, inversion of the foot, and flexion. All right?
Standing up.
No, let's have you lay down and I'll use this leg only.
Okay.
Very good. Okay. Time good? Ish. Okay, so remember how to do it? Go, I'm gonna have my hand here, lumbrical grip. Good. And then the other way. No, right. No, it goes the opposite way. So bring it up this way. So bring it to me. Flex and then out. Good. And then behind the other foot. Extend, 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 extend. Good. And then back to neutral. All right. Now bring it to me. Flex the knee. Flex the knee. And then push it up and up. Good. And then behind the foot. Extend, 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 extend. Good. One more though. Flexion. And then externally rotate. Grab that trash. Push out. Very good. And straight. So that you're going to try to do, let's have you do 5 and 5 of those at the beginning and then switch over to the easier one to finish out as many times as you can.
Okay.
Okay? So I don't know how a PT would prescribe this because it's not in the book or anything, but I assume if it's passive range of motion, we would be doing these kind of motions to get that facilitation going. And if there is an HEP involved, it would be along those lines. But as far as I know, that's the best course of action, training and teaching them along those lines. So that would be my PNF with my great patient, Mr. J, as far as showing those motions, controlling through passive range of motion, verbal cueing, as well as developing that motor plan.